A high-tech solution for a common issue that patients are at risk of developing in the hospital.
Yeah, we're talking about bed sores, which can be deadly. News 8 medical reporter Jocelyn Mementa now with what a Connecticut doctor has created to help save lives.
In the U.S. alone, every year more than 2 million people develop bed sores, also known as pressure sores, while bedridden in a hospital. Thousands die from it. Now, a Connecticut heart surgeon has developed a device that basically takes the pressure off, potentially a lifesaver.
Complications of bed sores or pressure ulcers kill about 60,000 people every year in the United States.
That's a football stadium's worth of people that are acquiring an illness when they're in the hospital trying to recover from something else.
Constant pressure and weakened blood flow damage the skin of bedridden patients. That can lead to tough-to-treat infections.
So we know healthy patients, they move themselves regularly, but when you're sick and in bed, you don't move at all. And that's when the pressure builds up, and that constant pressure occludes the blood flow, and that's where the skin will break down.
Heart surgeon Dr. Raphael Squitieri says best safety practices and well-designed hospital beds are not making a huge impact. So he came up with a novel approach, targeting the lower back area.
This center box is really the critical area where pressure ulcers develop.
TurnCare is an inflatable device, keeping the person in bed basically afloat.
This device is designed in a three-dimensional fashion so as to spread out the pressure evenly and then to move it around to restore blood flow to all these various areas.
Dr. Squitieri says study results here at St. Vincent's Medical Center showed those who used it were 5 times less likely to get a pressure sore and were likely to reduce their hospital stay.
These pressure ulcers really are the death of the skin over that part of the body, and that part heals very, very slowly.
Veteran nurse turned patient Linda Seaman.
It's a gentle, casual massage, alternating as needed based on what your body is telling the machine.
She relied on this high-tech tool after being admitted for a life-threatening condition.
Just some redness, and that happens very quickly just from being immobile because I was so critically ill. I had less pain, and my skin within 24 hours immediately looked better. The redness started going away.
Key to its success, says Dr. Squitieri, identifying the high-risk patient early on.
People of all ages are at risk for pressure sores. Among the most vulnerable, older adults. For more information, download our free News 8 app or head to WTNH.com. Back to you.